We learned more this afternoon about the cause of death of the actor Bill Paxton. Here's the new information. According to his death certificate, Paxton died last month from a stroke 11 days after surgery to replace a heart valve and repair damage to his aorta. The prolific actor was starring in the CBS series Training Day. At the time of his death, he was only 61 years old. Joining us now to shed some light on how this could have happened to such a young man is CBS 2's Dr. Max Gomez.
So, Dr. Max, you heard just what Maurice said. How common is this surgery to repair the aorta, damage to the aorta?
Well, it's the aorta and the valve both. This is what he had. Now, first, there's some important details that are not in Paxton's death certificate. But that said, replacing a heart valve is fairly common, although valve problems get more common with age. Now, Paxton apparently had a congenitally malformed aortic valve, and then an aortic aneurysm is a weakening or ballooning out of the main artery coming out of the heart. That's less common than a valve problem. And if Paxton had both problems, that suggests that he might have had an underlying condition that would have predisposed him to valve and artery problems.
So if you look at the death certificate, it said he had a fatal stroke. So is that because of the surgery? I mean, it was just a few days before.
It had to do, it almost certainly had to do something with the surgery, but there are a couple of different ways that could have come about. Again, it's very likely. Now, a combination valve replacement and aneurysm repair is a big operation that has a significant mortality rate, usually due to stroke. Now, what we don't know is exactly what causes stroke. First, there could have been debris on his bad valve or blood clots that formed there and in his aorta that could have broken loose and blocked blood flow in the brain, causing a stroke. But he was also certainly on blood thinners, which could have caused a brain hemorrhage, a different type of stroke. The fact that he died 11 days after surgery suggests the possibility that that's a kind of stroke he had, but it could have been either. So that's the details that we don't really know, because he had that stroke or he died 11 days later. So it's a little hard to know when the stroke happened and what type of stroke he had.
Can they ever figure it out, or is it just one of these unknowns?
No, I'm sure they did an autopsy and they had that. All the certificate says is stroke, and it could have been a couple of different things. So they could have know fairly well exactly what happened, but some of it will still remain unknown. Okay. It will remain unknown to us for sure.
You bet. All right, Doctor, thank you. You bet.